So hey guys, what's up? So welcome to World News 20 News channel. So let's talk about the disease seems to kill more men than women. Why? That men seem likelier than women to die of the novel coronavirus disease was reported earlier in the outbreak, and a paper by Chinese researcher published in mid-February analyzed data from Wuhan, Hubei, and China as a whole to calculate a fatality rate of 2.8% for men as compared to 1.7% for women. In subsequent weeks, as the footprint of the disease covered the entire planet, the same pattern was detected in almost all countries that released sex aggregate data, including Italy, Iran, South Korea, Germany, and France. Most recently, data from the National Statistics Office of the United Kingdom, where over 13,700 people had died by Thursday evening, showed that men were twice as likely as women to die from the COVID-19. India does not provide consolidated sex aggregate data on the fatalities. The question is why? The short answer: researchers don't yet know for sure, but several hypotheses have been articulated. One early theory based on the deaths in China was that men were more vulnerable because they were more likely to be smokers. About half of all men in China smoke, whereas only about 2 in 100 women do, and therefore more likely to have a lung condition. The hypothesis has been backed by data from China in a scientific paper. However, the gap between the percentages of smoker men and women is not as wide as in, say, Italy, Spain, or in the United States, all of which have seen several times the number of the deaths that have occurred in China. It has also been argued that smokers are likely to touch their mouths more often, and that some could be sharing cigarettes. Another hypothesis is based on the behavioral factors such as the likelihood of the woman being more careful than men about washing their hands, using soap, and being more likely to heed public health advice. But generalizing these traits across population and cultures isn't scientific. Microbiologist Professor Sarah Klein of the Johns Hopkins Bloomberg School of Public Health told the Guardian that she does not think that smoking is a leading factor, and there must be something universal that's contributing to this. Research, including by Professor Klein, has shown that men have a lower innate antiviral immune response to a range of infections, including hepatitis C and HIV. To COVID-19 is yet to be specifically studied. The guidance brought that their immune system may not initiate an appropriate response when it initially sees the virus, Professor Klein told the newspaper. So if you like the channel, so kindly subscribe to it.